All right, good evening, everybody, and thank you for tuning in this evening, depending on where you're watching us from, whether it's YouTube, Facebook Live, or on cable access. I'm Mayor Myron Bailey here in the city of Cottage Grove, and we're having a special session this evening to discuss and to share some of the information that the city has been doing to provide you information regarding the COVID-19 virus that's going through. And also had some people joining me this evening to share some of the information from some of our partners that are helping us deal with this situation. We will be answering questions throughout this process. We did have some opportunities for people to add things into our Facebook feeds earlier today and yesterday to be able to provide us with some questions that were out there. So we have those that we already have in front of us that we're going to be answering as best that we can today. On top of that, if you happen to be watching this on Facebook Live and you do have questions after you've been listening to us, especially after today with the governor's new order, feel free to put those messages in and they will get to us. As we're going live here, we will try to get those answered as best we can, and if not, we'll maybe direct you to where you can. I do want to thank our staff within the city of Cottage Grove. They've done a phenomenal job. I did want to share with the public, if you didn't already know this, the city of Cottage Grove about a week ago did declare a state of emergency, I guess a little over a week ago now. And that was really to kind of make sure that we had all of our ducks in a row to make sure we're prepared. So we do have an emergency management team that obviously incorporates the city council. And then we also, just earlier this week, instituted our emergency operations center to be official so that as this continues to move forward, we have more and more opportunity to make sure that the community of Cottage Grove is in a safe place, I guess is probably the best way to put it. So again, I want to thank our staff and everybody and all the employees of the city of Cottage Grove. All of you are considered essential employees. On top of that, I want to thank the citizens of Cottage Grove for doing everything they can to put a slowdown or a stop as much as we can to the coronavirus that's kind of plaguing our world right now, to be frank with you. So what I'm going to do is I'm now going to turn it over to, I'm going to mention who's here, and then we'll start with State Senator Carla Bingham, who is joining us this evening to talk a little bit about what's going on through the state. We have Dave Brummel, who is the Deputy Director of Public Health and Environment for the Washington County, who's joining us this evening also. Talk about a little bit about the county and maybe some of the questions that we can't answer. We also have our police captain, Gwen Martin, who handles all of our emergency operations program. She's been very, very busy, not even just since January, but even before that. And then also joining us today is Cottage Grove's Fire's Deputy Chief, who oversees our EMS department, John Pritchard, who is joining us today. So with that, I think I'll just go ahead and for a moment here and turn it over to our State Senator Carla Bingham.
Thank you, Mayor. I appreciate the opportunity to be here tonight to provide some information. And first, I'm going to say that please make sure you're following each of us on Facebook and Twitter because we constantly update information, and it is a great way to receive up-to-date information. These are uncharted territory, it's uncharted water, and I do know that we will get through this together. I would also like to thank the healthcare workers. I want to thank first responders, grocery store workers, teachers, parents, the faith community, truck drivers, making sure we get to restock the grocery stores, and the nonprofits for all they're doing during this time, and this community's really stepped up, which is no shock. We know that that's what this community does in times of need. So just want to thank everybody. But the most important thing is the best thing we can do to help them do their job is to stay home. And today, Governor Walz announced a stay-at-home order, which will start at 11:59 on Friday and go until 5 p.m. on April 10th. Grocery stores, pharmacies, liquor stores are going to be staying open, pet stores. We do have graphics on the website, mn.gov/stay-at-home or Stay Home Minnesota. That will talk about what is open and what is closed. Just some things that we're working on. Also talks about critical services, which is a big deal to what is deemed that would be critical for us to have our day-to-day operations, which is healthcare, pharmacy, law enforcement's obviously open, childcare, homeless shelters, food and agriculture, news media, energy, water, wastewater, and critical manufacturing. Throughout this process, which has been going on for a little bit now, we've been talking with large and small businesses, local leaders, nonprofits, child care providers, and local area leaders to find out what we can do to be of assistance to them. And first, I want to talk about or mention that if you've lost your job or hours have been reduced because of COVID-19, please go to the Department of Employment and Economic Development's website to fill out unemployment application. I just encourage people to fill it out even if you don't know if you would qualify or not. We are waiting on the federal government. My hope is they change the definition of who can qualify for unemployment so that it would be independent contractors and folks that typically would not qualify. We are waiting on the federal government to pass a bill that would have assistance not only to the state and feds, but to individuals and businesses. There are small business loans available through the Small Business Association. There's small business assistance through, again, DEED, the Department of Employment and Economic Development. If you have lost your health care, MNsure right now has an open enrollment period going on now through April 30th. Please go to the MNsure website. Sales tax that were supposed to be filed and paid last Friday are now moved to April 30th to be paid. You should still file the paperwork, but there's no penalty if you don't pay. Income tax on both the federal and the state level is now moved to July 15th. The Attorney General has a website for price gouging. If you see products that, we all have seen stuff on Facebook and social media outlets about different necessities that are being arbitrarily priced. Please report that, and the Attorney General's website will have a form for that. Evictions are on hold. So people will not be able to be evicted out of homes or rental units. And also, I think a big deal that was passed in the first state level bill, I think at like 3 in the morning on a Monday, insurance will now be covering telemedicine. Later in this presentation, you'll talk a little bit about what to do if you are having symptoms of COVID-19. But please try telemedicine. Your insurance should cover it. There are some things we're still working on and working through. Real ID, we're going to be hoping for an extension there. I know the president did announce that, but we're working on that with the federal government. And also making sure there are no penalties if your driver's license expired in this time, because we don't want you at DMV standing in a line anyway, let alone with this going on. So there is the website again, mn.gov/stayhomeminnesota. We all have social media. The area legislators, myself, Representative Ann Claflin, Representative Tony Jurgens, all have email updates that go out very frequently. Please go to our websites and sign up for those on the Senate and House. And I will entertain any questions that come up later on. So with that, turn it over to my friend Dave Rummel from Washington County Public Health.
Great. Thank you, Senator Bingham. Mr. Mayor, I want to start by echoing your comments, both of your comments, about recognizing those who are working hard to maintain all of those core services that Senator Bingham just referenced. I also want to thank Public Health for practicing social distancing measures and all of those community mitigation efforts. As you heard the Governor Walz say this afternoon, Minnesotans are doing their part. We're very proud of the public's response to these challenging times. We know that it's a challenge. We know that it's a sacrifice for us all. In public health, we know that this is a disruption to people's lives. It's a disruption to their livelihood. It's a disruption to employers and to the economy. But we also know one of the best ways to help slow down the spread of COVID-19 is to practice social distancing. And that's a really important message that I want to get across from public health. A little bit about the outbreak itself. The outbreak is now considered to be community-wide. So when I checked the Minnesota Department of Health website this afternoon, they were reporting cases in 33 counties across the state of Minnesota. Here in Washington County, we currently have 13 cases. But I do want to caution the public in regards to the case numbers. We all have heard about the current shortage of COVID-19 tests and materials. So right now, the Minnesota Department of Health and many private entities that are able to test are really prioritizing testing to hospitalized patients, healthcare workers, and those in group living settings such as long-term care. So with this limit in testing, what we're really suspecting is there are many more cases in the community. So that's why it's important for all of us to understand those main messages. Number one, stay at home as much as possible. That really is the best way to limit that public exposure to COVID-19. Stay at home if you're sick. I'll say it again, stay at home if you're sick. You'll hear it later on in the presentation. You know, we're really looking at a fever of over 100.4, any coughing or shortness of breath. Stay at home when you're sick. Make sure that you're washing your hands often. That sounds like such simple advice, but it is really excellent advice. Wash your hands often. I want you to know through this all, similar to the city of Cottage Grove, Washington County has also opened up an EOC, or an Emergency Operations Center. Washington County Public Health and Environment is operating out of that Emergency Operations Center. We are working very closely with our response partners, the Centers for Disease Control at the federal level, the Minnesota Department of Health. We're assisting both of those agencies in their overall disease surveillance efforts and case investigations. We're also working very hard to provide accurate information to the public, participating in forums such as this. There's a lot of misinformation that's going out around COVID-19. Some of the best information that I've seen from a public health focus is really the Centers for Disease Control website, which has some fantastic recommendations on COVID-19, and our local Minnesota Department of Health. They're keeping those websites up to date, and it's a great source of information. So, Mr. Mayor, Senator Bingham, with that, I'm going to turn it over to Captain Gwen Martin.
Thank you. Did you mention if people are sick, they should stay home? Okay. If you get nothing out of this presentation, please, if you are experiencing any illness, any sickness, you do need to stay home. So, since January of this year, the City of Cottage Grove's Emergency Management Division has been preparing for the spread of COVID-19. We are actively engaged in our nation's response to this pandemic to ensure that our city government is able to protect the health and safety of our residents and those who work in or travel through Cottage Grove. Our elected officials, city leaders, department directors, supervisors, employees have all been working diligently to respond to and mitigate the impacts of this new virus. Earlier this month, when the first positive case of COVID-19 was confirmed in Minnesota, our city formed an emergency management team to review our continuity of operations plan, manage internal and external communications, and coordinate our city's response to the COVID-19 pandemic. We identified roles and responsibilities, activated our emergency operations center, and we've been working together while practicing social distancing and utilizing virtual meetings to maintain situational awareness, to engage in conference calls with stakeholders. The number of meetings and situation reports that we get, we're really trying to stay on top of things and, as a city, continue to provide essential services to our citizens. So, one of the messages we have passed along to our employees and we want to pass along to everybody is slowing the spread of COVID-19 starts with you. Again, we cannot reiterate enough, please wash your hands frequently with soap and water or with an alcohol-based sanitizer. Cover your mouth and nose with a bent elbow or a tissue when you cough or sneeze. Avoid touching your face with unwashed hands, particularly your eyes, nose, and mouth, to prevent the virus from entering your body. In terms of social interaction, we all need to take a step back. Practice social distancing by staying at least 6 feet away from individuals who do not live in your household. Clean and disinfect frequently touched objects and surfaces. And above all, when you feel sick, please stay home. If you begin experiencing symptoms of COVID-19, which means you have a combination of a fever at or above 100.4 degrees, coughing, and a shortness of breath, notify your supervisor that you are sick, and please stay home and take care of yourself. One of the questions that people frequently ask is, well, when can I come back to work? You can return to work after 3 things have happened. You have not had a fever for at least 72 hours. That means 3 full days of no fever without the use of fever-reducing medications. And other symptoms have improved. For example, your cough is not being controlled by a cough suppressant. And at least 7 days have passed since your symptoms first appeared. So in simpler terms, if you get sick, on day 1, you stay home. On day 3, you're feeling better. So day 4, 5, and 6, 3 days, hey, no fever, no symptoms, I'm good to go. Not quite. You still need to stay home for that 7th day. You have to stay home for at least 7 days. Then you can come back to work. Otherwise, if you are sick, and let's say you're sick for 5 days, day 6, you're feeling great. No problem. No fever, no symptoms. Day 6 and day 7. You still need 3 full days of no fever and no symptoms. So you need to stay home for an 8th day and return to work on day 9. So we have been coordinating our city's response to this COVID-19 pandemic. We are continuing to provide essential services. Police officers, firefighters, paramedics, EMTs, we're still responding to calls for service. Our community development and economic development departments are still supporting our residents and our businesses. Information technology, I don't think they've slept in the last 2 weeks. They have been working extraordinarily hard to get as many people teleworking as possible. We do have people still working at City Hall, but again, we are maintaining social distancing, practicing the social distancing recommendations, disinfecting things frequently, and ensuring the safety while still providing services. So what I'd like to do is turn it over to Deputy Fire Chief Pritchard to talk about some of the things you might see if you are calling for assistance and somebody with gowns, masks, and gloves shows up at your household. Deputy Pritchard?
Thank you, Captain Martin. Excuse me. Thank you, Captain Martin. Number one thing we want all of our residents in our community to know is that we care about you and we're here to help you. When you call for help, we're going to be there to help you. So a couple things have changed in lieu of this COVID outbreak that might be a little bit different than what you might expect when an ambulance shows up. And actually that really does start when you call 911. So Washington County Dispatch, that is the one that you call if you call 911, who dispatches us to give you your help, will ask you a couple different questions. And these questions don't delay the response. The questions simply just help us as responders prepare to come help you. They will ask you if you have a fever, a cough, or shortness of breath. And these, again, are to keep our responders safe, because number one thing we can do, as we've heard a lot about staying at home and social distancing, is that if we can prevent those exposures and having our responders the correct personal protective equipment, or PPE, which I'm sure the term PPE is common nomenclature for people all around the world now. And so if you do answer one of those questions, and again, our response isn't going to be delayed, and we're still coming for you. So please answer those truthfully as well as you can, is that when we do show up on scene, typically in what I'll call normal times, you might see 5, 6 people coming in. And this time you might just see one person coming up to you. They might look a little cautious. They're going to have gowns on. They're going to have a mask on, some eye protection. And all of this is just to help us not be exposed to a possible COVID-19. We're still going to provide great care that you've come to expect, and that we truly believe that we owe our community. And then with that, they might stay, we're going to really try to stay at least 6 feet apart to ask you a few questions, but beyond that, we're still going to treat you appropriately and again, give you that high level of care. So don't be concerned you have somebody show up in a mask and gown come into your house. We're still there, we still have the ambulance out front, and we're able to provide that care for you. And then I'll turn it back to Captain Martin.
Thank you. We have a couple of questions. Mayor Bailey, if you would like to start us off with those.
Absolutely. So before as I mentioned earlier, we did get some questions that were forwarded to us through Facebook. And so we're going to go through those pre-questions at this point. But if you do have questions, you're watching us on Facebook, you're welcome to put some questions up. And our communications director is Scott Soroka is going to be writing those down and getting those to me. So if there's somebody up here, myself or whoever, can answer those questions, we'll be more than happy to do so. So question number one that we did get in, what is the city's plan going forward? Is Cottage Grove prepared to handle what comes next, as it appears things may become worse before they get better? So I think what I'll do is I'll maybe start a little bit of that, and then I'll, again, like we're doing here, pitch it to anybody that has any questions. So I did mention earlier to the public that we did do a declaration of emergency within the city of Cottage Grove, which did open up the opportunity for us to do more things to prepare for this, more tracking, making sure that we put all the processes in place. Second thing, of course, is the Emergency Operations Center, which was officially opened earlier this week. I will tell you that our process, there was a plan, not maybe specific for COVID, obviously, but the city of Cottage Grove has always had an emergency management plan for something similar to this. And so what we did is just we're making sure that this particular situation, that our plan fits within the situation. Any changes that we needed to make, we could make them at this particular time, which we have, as you were mentioning, some of the things we're doing differently that maybe you wouldn't have had to do in the past. With that, I will also share, though, that, as our city hall is physically closed, but we are still doing business in the city of Cottage Grove. So it isn't that you can't still come get a permit. If you have questions about water, anything, our public works are still out working the streets. They're filling potholes. Some of you, depending where you live in Cottage Grove right now, we're building another temporary treatment facility in the interim here. That is still happening. Building permits, like I said, all those kind of things. There are certain things that are not happening. For example, rental license reviews and things like that. However, we are working on some ways right now virtually to be able to do that. And so there is, again, some different things that we're doing. We, as a city, have already had a couple meetings, one a city hall meeting, or city council meeting, and a planning commission meeting, where we did it virtually. With the declaration of emergency situation, we can do things differently now, and that still allows the public to provide us input on anything that's going on in the city, but it also allows us to continue like we're doing here, with some of us being in here six feet apart, but we did at our last council meeting, had 2 council members that joined us remotely. So we're practicing what we're being told by the CDC. That makes smart sense, and we'll continue to do that going forward. So I don't know if anybody else had anything else they wanted to add. Glenn Martin?
Thank you. Mayor Bailey, you referenced we've always had a plan, our emergency management plan, and we also have what we call a continuity of operations plans. And what that does is that helps us to manage the emergency and manage the businesses that we normally provide. This pandemic is unique in that it's unlike that I hate to say a typical disaster, but other disasters that we know of, the tornadoes, the earthquakes, the blizzards, they affect infrastructure, buildings and the like. A pandemic affects the human component, and it affects our supply chain. So one of the things that we really started to look at as an emergency management team is how is this going to affect our workforce and the stuff we get? And not just the gowns and masks and gloves to provide protection for our first responders, but computers. with the community mitigation strategies that were recommended, the social distancing, emphasis on teleworking, we needed to ramp up our city's ability to allow our employees to work from home. And the backlog of ordered devices that would allow people to work from home presented some unique challenges. And our city has stepped up, and all our departments are working together, and sometimes we've come up with some unique solutions to try and help address the impacts that this pandemic is having. When the schools closed, our workforce, a lot of the parents weren't prepared to stay at home and care for the kids, so the schools opened up and helped with the childcare, and I'm sure you can speak to that a little bit more if people had questions about that. And so we've just been, this is a work in progress. Everything is evolving, it's changing. Probably since the time we started this presentation, there's some new information out there on the CDC's website. So we are trying to stay on top of things and be flexible and adaptable and continue to provide the quality service that we do.
Okay, did you have something you'd like to share?
Yes, Mr. Mayor, I would like to piggyback on that. You know, just to point out, the public has heard a lot of terms about our pandemic plans, about both the city of Cottage Grove and Washington County opening up our emergency operations centers. Gwen just referenced our continuity of operation plans that really assure business continuity. From a county perspective, we are also doing those same things. We have those same plans. The county, much like the city of Cottage Grove, we have closed to those face-to-face interactions, but the county is still open for business. We're looking for all those ways that we can provide our services, but still provide that social distancing. Where can we do things online? Where can we do things using telemedicine? But the other thing I want the public to know is when we're talking about how we respond, both at the city level, the county level, the state level, and the federal level, we're all using the same structure, which means that we're using the same language. So as we started to respond to this latest COVID pandemic, this isn't the first time that the county and the city, or Gwen and I, have met each other. We have been training long before this happens. We speak the same language, and so as we look in the future how we're going to respond, that positions us that if the county needs to assist the city of Cottage Grove or vice versa, we're already speaking the same language. And that puts us, I think, as an advantage to really be proactive to try and address what's might be coming in the future.
Okay, Mr. Pritchard, do you have something to add?
Just be able to speak from our Department of Public Safety. We have over 100 dedicated and passionate professionals that are here to help you. With all the attention on COVID, we just want to assure people if you're having a mental health crisis, a victim of domestic violence, you're having chest pain, we still want you to call 911 and we want to come out and help you. We still have over 100 dedicated professionals working 24 hours a day, 7 days a week, and we're here to help you. So all those services continue. And again, we want you to call us for help if you need it during this time.
Yeah, and it's a great call out too, because I know we were actually talking a little bit about that before this live event started. Was one of the interesting, sad things on top of what's going on with COVID-19 is because everybody's in tighter quarters now, so to speak, in homes and such, domestics have been significantly on the rise. And we're not just talking Cottage Grove, this is across the United States. And so we don't want people to be afraid to call for help if they need help. You do not have to stay in an abusive situation, whether it's you as an adult, whether it's you as a child, whatever. You should still call, and we will still respond. And there are lots of agencies out there. I know there's state agencies, there's county agencies, crisis groups, the Youth Service Bureau, you name it. There's all these groups out there that are here to help you during this time. So it is one thing to deal with what's happening with COVID-19. It's a whole nother issue of COVID-19 is the mental and the mentality and the impact that this may be having on individuals either because of what's happening with COVID-19, because we're in a different world right now, or because maybe things that have been fostering in families are going to rear their ugly head, unfortunately, in this situation. So, and the other thing I want to mention on this real quick on continuity of local government. One of the things, just to be very clear, you talk about continuity, I was very impressed when we had our first meeting because they literally, our staff has literally taken it where if this person were to get sick, this is the next person in line, and it's like way down there. I mean, we know how many officers could be sick, how many public works officials could be sick, paramedics, you name it. And there's somebody to take over what they're supposed to be doing as a critical element of running a city. So for those that are concerned that there's certain things that are going to fall through the cracks, I can assure you, and I'm sure I can speak for the county too, that's not going to happen. We've got plans in place to make sure that everything continues to move forward. So anything else on this question? All right, question number 2 is, restaurants remain open for pickup, but isn't that just another way the virus can and will spread? Is the government still inspecting restaurants to ensure safety and health procedures are still being followed? So maybe what I'll do on this one is I'm gonna kick it right over to David there to maybe talk about what's happening with that, and then we can maybe add some additional info to it.
Great, thank you, Mr. Mayor. The short answer is yes. The county is still working with restaurants. As I spoke in my intro comments, I talked about how we opened up our Emergency Operations Center. And in that structure, one of the units that we have stood up and activated is what we're calling our food safety unit, and that is those restaurant inspectors. Prior to COVID-19, they were doing that work. Now we've really focused and said we really want them to prioritize on keeping people safe in COVID-19. It's a great service for our restaurants to be providing takeout food. We want to talk about food access and food security, and they play a critical role, but we want them to do it in a safe manner. So that food safety unit that we've stepped up at the county, they're in touch with their federal and state partners, getting the most up-to-date recommendations as things change within this COVID outbreak and pandemic. So yes, we are working with our restaurant establishments.
And just so the general public is aware, and I'm going to turn over to Gwen about maybe that first question or comment, and I can read it again if you want, because maybe we can pitch it to each other. On inspections are done by the county. So that is not something specifically that the city does, but if we were to see something or have concerns, we obviously alert the county too. The other part, and I know this has been out there, and we've been hearing different words or comments about it, and that has to do with, can we get the virus, or could it spread on, food containers and things? And I don't know if you want to add, a couple comments on that question.
Sure, thank you, Mayor. We don't know a whole lot about this virus. It is a new virus, and the stuff we are learning every day gives us a little new insight in our changes practice. But the one thing has been consistent: wash your hands. Wash them with soap and water. The virus gets in your body through your mucous membranes by touching touching a surface that may have a virus on it, shaking somebody's hand who may be infected, getting coughed on, getting sneezed on, and then when we touch our eyes and our nose and our mouth, that's how we get the virus. So if you are concerned that something has virus on it, you're picking up a styrofoam take-home container, and you've got it opened up, wash your hands before you handle your food. I believe you were going to comment about that, Senator Bingham, as well?
I think the CDC has recommendations that if you bring take-home food home, to remove it from that package, obviously washing your hands, and then putting it on your own plates or bowls or whatever, using your own silverware, and again, washing hands before and after eating. So I think that using those kind of common practices, common sense practices should hopefully mitigate some exposure.
And I guess I would just put this out there, because obviously the restaurants are still open for takeout only, obviously, or call-in or delivery in some cases. But I've also heard it through the same comments related to grocery stores. So if you're taking stuff home from your grocery store, you should do the same thing. I know a lot of people already, you pick up your fruits and vegetables and things, the fresh stuff, you always want to wash them anyway. But the fact of the matter is now more than ever, even in going to the grocery store, all of this is just to be extra safe. All of this is truly to the public to be extra safe. We don't know 100% yet, as Gwen Martin mentioned, because the CDC is still learning from this. And so things could change. But the fact at this point is it's better to be safe if you do purchase something, whether it's a fast food kind of situation restaurant or a grocery, I would just make sure that you, again, wash your hands constantly and hand sanitizer if you can get some, but also make sure that you wash everything off, even if it's coming from the grocery stores. Okay, anything else? Again, I will just mention that if there is anybody that has questions as we continue on through Facebook, you're welcome to post those out there. So I'm going to move to our third question, which is, how should we be using our parks and trails? There is a particular concern surrounding playground equipment. I can start with that one, and then maybe I'll kick it over to talk about the county. The parks and trail systems within Cottage Grove are open and will remain open. So I wanted to mention that. Matter of fact, I will tell you, again, me as the mayor here in Cottage Grove, and personally, I always like to try to look for what are the positive things that come out of bad situations like this. And one of the positives that I've noticed is the number of people that are out walking the trails, the number of people that are walking their dogs, no matter what time of day it is, literally, which is awesome because Cottage Grove has some of the greatest trail systems in the state of Minnesota and the greatest parks. The one thing that has changed, and it actually came out today with the governor's new information as it relates to what should you avoid and not go to, is playground equipment, all right? So as of, I guess 12:59 or 11:59 on Friday, but I would just do it from now. I would not have your kids or anybody go on any of the playground equipment because our Parks and Rec department does not have the ability to go wipe down everything, all right? So can you go into parks and use the trails and such? As it gets warmer out here, maybe even later on this weekend, it could be in the 60s, sit in the grass or whatever, absolutely. Make sure you do the social distancing of 6 feet. But when it comes to utilizing the equipment that's in our parks, I would ask that all of you please do not have your children go into those different parks. And I know we have some amazing equipment, and this does also include our inclusive playground down at Woodridge. We just don't have the ability to go out and clean this equipment on a consistent basis like it would need to be to prevent the spread of the COVID-19 virus. But you can use everything else. We are not, at this point, we are not planning on putting fencing or anything around our park equipment. We are putting some signs up in our parks, though, to remind everybody, that the actual equipment is off limits and why. And again, that the park trails are open, parks themselves in essence are open, but just use your good social distancing guide. And I would just share with you, our public safety isn't going to be out there ticketing people that are walking too close together or things like that. That's not going to happen. What we are asking you to do is use good sound judgment when it comes to, if you see somebody at the park, I've had people reach out to me, well, there's a group of 20 kids playing basketball, or there's kids playing on the equipment. It might be one, I know this may sound weird, they might not know that this has happened in the sense of that things are shut down like that. So please share that with them when you're there. If we see it, obviously we'll mention it to them. If we see kids playing in the parks in our office or CSOs or whatever out there, we'll make sure that we mention that too, because again, if we all work together through this, it's going to get done a lot quicker. So I'm going to turn it over to Dave in the center about Washington County Parks. Yes.
Yep. Thank you, Mr. Mayor. Yes, the Washington County Parks are available Yesterday, the Board of Washington County Commissioners met, and they approved to waive all park fees within Washington County. So a very similar message. We are encouraging people to use our parks, the Washington County parks. Again, maintain that social distancing, much like we're doing here tonight, of that 6 feet. But it was brought up earlier in our conversation, again, about that self-care and taking care of your mental well-being. And we know that getting out in nature, getting out to recharge your battery, walking a dog, walking your dog, going out for a run, enjoying those parks is a way for us to get out of our houses. And this is something straight off of, I was really glad to see this. Again, this was shown earlier at the Stay at Home Minnesota, and it's on that website that Senator Bingham referenced earlier. And even in there, they're encouraging, walk your dog, ride your bike, be in nature. So in short, use our parks.
Absolutely.
But remember that social distancing.
There you go. Senator Bingham?
No, I was just going to reinforce that, as the owner of 2 rescue dogs myself, it is important to utilize these facilities now and really, as a stressful time, a nervous time for folks, to be able to decompress and just be in nature, I think is important. Ride your bike, be in nature, walk your dogs, and utilize those facilities. And I do know that the county board will be revisiting extending the free entry to the parks. I was just communicating with Commissioner Johnson, and I know that we have such gems of county parks and city parks. We are so blessed in this area to have that, and we all take pride in that. So let's get out there, utilize them, enjoy them.
Absolutely. All right. Question number 4 is, has there been a confirmed COVID-19 case within the city of Cottage Grove? And I'm not sure, I'm going to send that over to Dave for the county, because he'll be able to explain a little bit better what that means. Or what the answer is, I guess.
Thank you, Mr. Mayor. Right now, the county currently, always, we're following the Minnesota data practices. So what you'll see is the Minnesota Department of Health, they're reporting case information at the county level. And to maintain that data practice, that data privacy, they're only releasing data at the county level. So they're not releasing case information down to the city level. I do want to refer back to some of my opening comments about, with the limits of the current COVID testing, because the state is that shortage, they're limiting, again, to hospitalized patients, healthcare workers, and those in those long-term care facilities. So I said earlier that we are really assuming this is community-wide. This is a widespread pandemic. So really with that, you can assume that there are cases in your community, even without the state reporting.
Absolutely. Any other, Gwen or anybody want to talk on that? I'm just looking to see, have we had any questions at this point coming through Facebook?
Mayor, we did have one question. The question is, what if I am not an essential worker? Can I go back to work after 11:59 p.m. on Friday? Opening this question up for discussion for the group.
All right, I'm not sure who wants to take that one. If he's not, or they are not an essential worker? Are you talking about on the end date, right? The date that the first, or the 10th? That's what I'm trying to understand. Can you read the question one more time, just to be clear?
Yeah, I can read it. What if I am not an essential worker? Can I go back to work after 11:59 p.m. on Friday? I think the question
No.
is this weekend, can I work if
Only
I'm not an
essential workers
worker?
are supposed to be
Yeah,
going to work.
that's-
And
okay, so that's better.
Again, I'm going to refer to the stay home, and then talks about if only you're an essential employee, you should be staying home during this time until the 10th, April 10th at 5 o'clock.
So maybe what I'll do real quick, and maybe they can pop this up on the top. I'll start with what is opened and what is closed. I know Senator Bingham had held this up. Those items or those businesses and such that are open are hospitals, clinics, the state legislature, food, which does include grocery stores, farmers markets, food banks, convenience stores, bakeries, takeout, and delivery restaurants, pharmacies, food shelves, as I mentioned, convenience stores, liquor stores, childcare facilities, news organizations, gas stations, funeral homes, banks, hardware stores, and the post office. Items that are going to be closed or are closed are dine-in restaurants, bars and nightclubs, entertainment venues, gym and fitness studios, zoos, museums, arcades, playgrounds, bowling alleys, movie theaters, concert halls, country clubs, salons and barbershops, tattoo parlors. Now, I will mention it notes there, this is not a complete list, but the reason it's not a complete list is because, I don't know if they want to pop me back up there, there is a very lengthy list, and we will link it on our site if you're interested to take a look at it, that has a yes and no from the governor's declaration of exactly what type of businesses are able to continue to work or be open past those dates. Though the other thing I will just mention real quick too is in some of those businesses that I just mentioned to all of you that are currently open, many, including grocery stores and such, are reducing their hours. Partly because they need to restock, partly because there is a fear out there right now where people are having a hard time finding employees that, and if somebody feels that they're sick, they're going home, which is the right thing to do. So there are some businesses now that are really crunching their hours. So I would encourage you to, check their website, Facebook page, or give them a call to see if there is something that, or if and when they are actually open. Senator?
Mary, it's been a long time since the two of us have been on a dais together. Probably 2007 was the last
while.
time. Yeah, but I wanted to point out a couple things. One was on the open list that you mentioned, these businesses are practicing and expect you to practice the social distancing as well. So specifically funerals, it's a very difficult situation, but you do have to keep in mind the social distancing side of that too, as far as wakes and funerals and stuff. The other thing I wanted to mention are the bars, restaurants, and other public accommodations, which means hair salons and barber shops. Those are actually going to be closed till May 1st.
Yes.
And then for schools, contact South Washington County Schools, and if you're watching from a different district, contact your school district. But from March 30th to May 4th, they are going to still be doing the distance learning for folks. And I know the school district has a lot of information on their website, and teachers have been reaching out to students and to families on assignments. So just keep checking that website as well. But I wanted to point that out on that flyer as well.
Perfect. Anything else for the rest of the group? All right, you have another one, Scott?
I do. Next question, are window installers considered as an essential worker?
That is
On your list.
yeah, I don't believe they are. They are not considered essential. And so again, what I would, if you can see this, and I know it might be real hard to see on the picture, the print is extremely small, and what you'll notice is it literally lists each category, page after page after page, and then on the far, there's a code, because they call them industry codes, that the governor used as a basis for deciding, with his staff, I'm sure, on what exactly needs to be, should be open and kept open, which should not be. And then there's on the last column, it says yes or no. As an example, if you look through this list, it's going to tell you, for an example, auto parts stores are considered an essential function, so they are listed as open. Auto dealers are listed on here as no, meaning they should not be open. So there are some things on here, but to answer the question about window installers, there is a very different lines for different types of construction. There's certain construction that is available or can be continue past Friday. There are some items that cannot. I would just refer you specifically to this list, and it's also on the COVID website that the state has put out there through DEED, and I'll give those again, and we'll have those up on our site so that if you do have a question about that, you can check that out. One thing about that, because I've also received some phone calls and emails and such personally today about, well, is my business considered an essential business? We've had business park businesses reach out to us too. Again, we as a city cannot truly make that determination for you. What you need to do is, if you are that business owner, you can check with the state and go through that process. Or frankly, you can check with your business. But as our senator was just mentioning, all businesses, whether you're open or not, should be practicing, the washing the hands, the social distancing, if possible, working from home. But I would encourage you to reach out to your individual business owner or your boss or whoever where you're working to touch base with them. So I don't know if there's anything else anybody wants to say on that. Great question, though. It's on here, but I would have to really put on my glasses and dig deep on the line unless Carla or
I haven't
Senator
been able
can
to
see it.
locate that exact, textile mill product says no. I don't.
Yeah, I think if I saw in
Wood
there,
preservation, sawwood mill, wood product manufacturing, plywood engineered, no. So, basically, wood product manufacturing, glass, no. So, I'm gonna
assuming-
say no.
I'm going to say no, but again, what I would encourage you to do is check with the state.
Yeah.
If you have a question, they'll be able to help you more so than us at this point.
We have one more, Mayor, and it's in regards to a previous conversation that we had in regards to auto service department workers.
Yeah, and what I noticed on here, and again, we just got this not that long ago, so I want to apologize to the public to say that we haven't, as a group up here, been able to really dive into the list so that we know. There is a lot on this list. I mentioned about auto parts, but I did not see anything specific to auto repair at this point. So maybe as we're talking, our senator, and again, she is kind of going feverishly through, we'll have to defer that.
I actually think auto service was
Approved.
approved.
Yeah.
But automotive parts, accessories, and tire stores, they're all open, so I have to believe
I
to
would
buy
think
the
so.
product, the people that actually use the product would need to be open as well, so lock it in, yes, they're open. That's my final answer.
Oh, we're playing Who Wants to Be a Millionaire?
Yeah.
Okay. There we go. So we heard it directly from Senator Bingham. Any more questions?
Mayor, at the risk of sounding like an attorney, no further questions.
No further questions. I do want to mention one thing, and then maybe I'll turn it real quick over to Gwen. There was a question that we had saw before that we didn't necessarily talk about here, is there was somebody that was asking a question about medical services. I think that was early in the week. And what I mean by that is Cottage Grove does not have a hospital. Woodbury does, Hastings does, obviously St. Paul and such. What, if anything, should there be a need within our community? And I know the answer to this, but that's why I'm gonna tip it up here for Gwen Martin to bring up. Is there an availability, if needed, if it got to a point where they needed to do like I'll call it a tent hospital or something like that, similar to what they're doing, unfortunately in New York and such now, where they're using convention centers and things like that to create these centers to care for coronavirus people. So Gwen, you want to start with that?
Sure. Thank you, Mayor. Certainly, what I've heard is that the state is going to be working with the Army Corps of Engineers to be looking at various facilities that they could turn into temporary hospitals, whether it be current structures like our ice arena or hotels, things like that. So when they reach out to us, certainly we will let them know what type of facilities we have. In the event of certain emergencies, the Red Cross is prepared to set up a shelter in our ice arena. So we already know that that facility exists and could potentially be of use. Whether or not it gets used as that, we don't know at this point.
Okay. Anything on the county side, David?
Just to add that's a perfect answer from Gwen, or Captain Martin. And I know that those conversations have started in the metro area to start identifying those in the metro region. They're called an alternate care facility plan, and there is a metro plan. Again, as you said, this would be the state taking the lead on that. So there are groups and individuals that are leaning forward and starting those planning efforts, or continuing, I should say.
There you go. Thank you, David. Senator?
Yeah, Captain Martin said something that kind of turned the light bulb on, which is if folks want to donate blood, please contact the Red Cross. They are in need of blood donations, and I know after this day, I know there are scheduled blood drives also to help bring up the amount that we have, because they are really focused on getting blood donations. So just I think they're doing it by appointment. So if you can and are willing to, that'd be helpful.
Yeah, and I guess that would be a kind of also a great segue to just talk briefly. I know it didn't come up as a question, though I've seen it all over Facebook over the last few weeks, and that is the fear of this has really caused what I'll call panic buying. Toilet paper, paper products, certain, mac and cheese, you name it. There's certain things out there, hand sanitizers and such. The supply chain is working, it's just working really slowly right now, and I'm speaking just from what I know from where I work. Eventually, if we're all careful, they can catch back up to where they need to be, all right? So I'll mention that right off the bat. I've not heard any issues whatsoever with food. In other words, there will be food that's continuing to flow. There's enough of that out there. So going into stores and doing panic buying is not the right thing to do, especially if you need only so much for a week or so, or a few days or whatever, wherein somebody else is desperately in need of it because they literally are out. So I just ask, I want you obviously to continue to shop local. I'll throw my little 2 cents, my plug in there on that. But let's be respectful to each other, both in the stores, but whether it's, customer to customer or customer to employees. I do know, as I said, that this is a stressful time. I do understand, because I have witnessed this, where employees are getting berated because they're out of toilet paper or they don't have something that certain people wanted within the store. You can't blame the employees. This is kind of took everybody, as you know, by surprise, especially in the retail sector. But they will work to get it, the businesses are working to put those items back into the stores as quickly as they can. And I know the senator mentioned about trucking, and we appreciate the truck drivers and the delivery personnel. And yeah, there is some slowdown because this took everybody by surprise and everything got wiped out, so to speak. However, on the other side, I want to talk about some of the really neat things that I've seen coming out throughout our community. For any of you that happen to go through the drive-through at Starbucks, I saw this morning, they have a sign up on their window in the drive-through with 3 rolls of toilet paper said, if you need something, need toilet paper, let us know. And literally, they will give you some toilet paper. You have to buy it, you have to whatever, but it's neat things like that where people, great businesses, great people are reacting. I've heard people talk about buying gift certificates or gift cards from our local restaurants. I literally saw great social distancing, people standing separated, waiting to get their food at Chipotle. So if we do this kind of stuff and we all work together like that, both for our businesses as well as individuals, we're going to get through this thing and we're going to be better for it in the end. I really, truly believe that. Senator?
Mayor, just to piggyback off that, I want to thank the businesses too, because they've taken it upon themselves to set aside hours for our seniors and our elderly. And, that's where the hoarding really hits home the most. They may not have a car to get someplace, and they're lucky enough to have somebody to help them get to a store at 7 and 8 o'clock when Target or Hy-Vee allows the elderly folks to come there, and then they're clear off the shelf because somebody came in and bought 50 rolls of it, of toilet paper. And that puts more stress on especially our elderly and our seniors that may not have family around. And so, I mean, let's just be kind to each other, look out for each other, and we will get through this. And I also just want to encourage the businesses to watch, the limits on stuff. Like maybe, try to limit people to 1 or 2 items when it comes to toilet paper and enforce it so that it does kind of let us get some time here to get the truckers out, to get the supply up again, because that's what it's going to take. But there is no need to panic buy. There is no need to hoard. We will have enough. And we will, through our business and through our farmers who are going to continue to make food, we're going to be fine with that, but we just got to be respectful and kind to each other.
Okay, thank you. That was great, great comments. Gwen, Martin, do you have some closing remarks?
Yes, thank you, Mayor. Again, information about COVID-19 changes rapidly. There is much to learn about this new coronavirus. We want people to be prepared, not panicked. So here's what you can do. Stay informed. Look to trusted sources of information like the CDC or the Minnesota Department of Health, rather than random tweets or posts or blogs. Check on your families and friends and neighbors. Offer to pick up groceries for someone in need. Food banks and soup kitchens across the country are expecting to see an increase in demand. Connect with your local volunteer organizations and donate some money, some food, and some time. You can even volunteer remotely from inside your home. There are organizations that are starting to create volunteer opportunities, such as calling and checking in with senior citizens who live alone and have limited support systems. And again, if we haven't said it enough, if you are sick, please stay home. Take care of yourself, take care of your family, and do what we can to slow the spread of this virus so our healthcare system isn't overwhelmed.
Thank you, Gwen. Mr. Pritchard, anything you want to add?
Just again, thank you for the invite to participate in this forum. It's just been incredibly insightful and a blessing to be part of such a great city and great community. And we're here for you and we want to help you. So please call us if you need any help.
Perfect, thank you, John. Dave?
Thank you, Mr. Mayor. I'll keep my closing comments brief. I just want to emphasize again, stay at home, Minnesota. Right now, this is the best tool that we have in the toolbox to slow down the spread of COVID-19. And as Captain Martin just referenced, really what we're doing is we're buying time for our healthcare workers. As you heard the governor say earlier today, this afternoon, that if we don't slow down COVID-19, that our hospital system does not have the capacity to take care of all those that will be getting sick. So it's essential. Again, we're all in this together. Within public health, we know it's a huge burden for the public to stay at home. I commented earlier that we know that it affects everyone's lives, your livelihood, your employment, the economy, but we really emphasize that this is the best tool in our toolbox to slow the spread down.
Fantastic, and thank you so much for joining us this evening to share your insights from the county's perspective.
Thank you. Happy to be here. Thank you for the invite.
Thank you. Thank you. Senator Bingham?
Thank you, Mayor, and thank you for allowing me to be part of this. This is, I hope, has been resourceful for people watching at home and to be able to review at a later time. I don't think I could add anything to what Captain Martin has said over there, other than sign up for email blasts from the Department of Health, from the governor's office, from any of the area legislators, just to stay informed. We're here as a resource, and if we don't know the answer, we certainly can hopefully get you in the right direction to get an answer. I know these are stressful and trying times, but we're in this together, and we will get through this together. Support our local businesses if you can. Purchase gift cards at restaurants. That helps get capital in the door right now for them. And I'm going to just say it again, be kind. Check in on your family, check in on your neighbors, be considerate and helpful, and we will get through this.
Fantastic, thank you. And again, thanks to all the teamwork that this group has put together along with the rest of the city staff, the county staff and such. A couple things as we're kind of getting ready to sign off here. Again, if you still have further questions that you have, you can obviously send those in through our Facebook page, or, you know, can reach out to, frankly, any one of us here, and we'll be more than happy to try to help you get those questions answered. The one thing I did want to mention, because Senator Bingham just brought this up about checking in on people, our public safety department is offering the chance or the opportunity, if you, whether you live here locally, someone outside of the area, and you got family or somebody that you're concerned about, we will do periodic checks. So if you have a family member, an elderly person, you name it, that you are concerned about within the city of Cottage Grove, we will go out and meet up with them and make sure that they're doing okay. And if you look on the screen right now, if you want to email Cottage Grove Emergency Management, which is em@cottagegrovemn.gov, we will make a point to go out there and check on a family member or an individual that you're concerned about, because we don't want anybody in Cottage Grove feel like they're alone. We want to make sure that they know we care about them and somebody's looking out for them. And whether it's a family member needing our help to do that, or you're just chatting with them or whatever, we want to make sure that we help. If you do, as you heard earlier, we referenced a lot of different websites, but this is truly, these are some of the key websites that you could go to get more information as things continue to change or evolve, including possibly dates of extensions and things like that too, for these different pieces that are going on. But for more info on Stay Home Minnesota, you can go to mn.gov/governor/COVID-19 /. For health-related information and questions, you can go to health.state.mn.us /. And then for business and retail-related information, which I know our Senator talked about all the different opportunities for loans and things like that that we're working on to make sure our small businesses, and all businesses for that matter, can make it through this trying time, is mn.gov/deed, which is DEED, /newscenter /COVID /. I do know our local chambers are also forwarding information out. I've seen a variety of information that's coming from them. And I would tell you that from the City of Cottage Grove standpoint, we will continue to keep everybody updated on anything that we can provide from a city standpoint that deals with both local, but if there is updates to different pieces of what's going on with COVID-19, whether you go to our city website, which has a specific link that you can see all the latest information, or where to find the information, or our Facebook pages. I mean, I think we're on Twitter too. We're doing, wherever we can, we're putting the information out there. So I just again want to, thank both our staff for making sure that the city staff and the council and the group up here and all our electeds up here for making sure that we as a team are working together. As we're working together on behalf of all the citizens of Cottage Grove and frankly the state, all of us are in this together. So we'll do our part here in Cottage Grove. I know the rest of the state will. I'm very proud, I do want to say this, I'm very proud of our city after we've started this process of our emergency management of this program. We had numerous cities reaching out to us to ask us how did we get all this information put together so quickly from when the declaration first came through. And it's because we have such a great team, Glenn and Pete and you and Jennifer and you guys. That's why, is because we kind of saw that, not that we knew what was coming, but you guys plan in advance. And that's the one thing I can say that's great about this community is no matter what it is, this is just one piece of a bigger puzzle that we plan for, and we do it with our partners from Washington County and the state of Minnesota. So please be safe out there, practice social distancing, and if I don't say this before we sign off, if you're sick, stay home. All right, if you're sick, stay home, literally. And if you have, again, any further questions or information that you would like us to provide, please reach out to us. So the rest of you, thank you again, all of you, for joining me this evening, and we'll talk to all of you soon.